Hello everyone, welcome back to Medifit Mosaic. Today we are covering a crucial topic that affects many expecting mothers, gestational diabetes. Studies published in Diabetes Care show that about 50% of women who develop gestational diabetes will go on to develop type 2 diabetes within 5 to 10 years after pregnancy. Another study published in Journal of Clinical Endocrinology and Metabolism found that with proper management through lifestyle changes and if necessary medication, women with gestational diabetes can significantly reduce the risk of complications for both themselves and their baby. Whether you are pregnant, planning a pregnancy, or just looking to learn more, understanding gestational diabetes is key to ensuring a healthy pregnancy for both mother and the baby. In this video, we will break down exactly what gestational diabetes is, what causes it, the symptoms to watch out for, and how it differs from type 1 and type 2 diabetes. Plus, stick around until the end for an interactive quiz to test your knowledge on the basics of gestational diabetes. Trust me, you won't want to miss it. Let us jump right in. First thing first, what exactly is gestational diabetes? Picture this. You are moving through your pregnancy smoothly, but as your baby grows, your body undergoes massive changes. One of the lesser known changes is how your body handles insulin, a hormone that is responsible for regulating your blood sugar levels. Now, in a typical pregnancy, as your body adjusts to accommodate the baby, the placenta produces various hormones such as human placental lactogen HPL and estrogen that helps your baby develop. However, these hormones also make your body cells less responsive to insulin, which can cause insulin resistance. Normally, the pancreas can compensate by producing more insulin, but for some women it can't keep up with the increased demand. As a result, blood sugar level rise, and that is when the gestational diabetes develops. Gestational diabetes is typically diagnosed during the second or the third trimester of the pregnancy, when insulin resistance tends to be at its peak. The important thing to note here is that gestational diabetes doesn't mean you had diabetes before pregnancy or that you will have it afterwards. In most cases, it is a temporary condition, but here is the key takeaway. It does increase your risk of developing type 2 diabetes later in life, both for the mother and potentially for the child. This is why it is so important to monitor and manage the condition throughout your pregnancy. Now that we have covered what gestational diabetes is, let us talk about why it happens. The exact cause isn't always clear, but several factors can increase a woman's risk. Let us break these down. The number one is insulin resistance. During pregnancy, your body produces certain hormones that help your baby grow. But at the same time, they make your cells less sensitive to insulin. Think of it as your cells becoming resistant to insulin message to absorb sugar from the bloodstream. As pregnancy progresses, this resistance increases, and in some women, the pancreas can't produce enough insulin to compensate. This results in elevated blood sugar levels, leading to gestational diabetes. Number 2 is obesity and the weight gain. Being overweight or obese before pregnancy is a significant risk factor for gestational diabetes. Excess body fat, particularly around the abdomen, increases insulin resistance, making it harder for your body to manage blood sugar. Additionally, gaining too much weight during pregnancy can exacerbate insulin resistant. Number 3 is family history of diabetes. Like many other health conditions, genetics play a role. If you have a family history of type 2 diabetes, your risk of developing gestational diabetes is higher. Your body might naturally be more prone to insulin resistance even before pregnancy. Number 4 is age. Age is another factor. Women over the age of 25 and especially those over 35 are at an increased risk. As you get older, your body becomes less efficient at handling insulin, which raises the likelihood of gestational diabetes. Number 5 is previous gestational diabetes. If you had gestational diabetes in a prior pregnancy, there is a good chance you might develop it again. Remember, gestational diabetes can occur even if you don't have any of these risk factors. Every pregnancy is different, so it is important to work closely with your healthcare provider to keep an eye on your blood sugar levels. Now let us explore the symptoms. Here is tricky part. Gestational diabetes often doesn't cause obvious symptoms, which is why regular screening during pregnancy is so important. However, if the symptoms do appear, they can sometimes be subtle or resemble common pregnancy discomforts. Here is what to look out for. The number one is increased thirst and frequent urination. Much like with other types of diabetes, high blood sugar can make you feel constantly thirsty. As your body tries to get rid of itself of the excess sugar through urine, you might notice you are making frequent trips to the bathroom. This can become especially noticeable at night. Number second is fatigue. Pregnancy and fatigue go hand in hand, but extreme fatigue that doesn't seem to improve with the rest could be linked to gestational diabetes. High blood sugar can leave you feeling drained and low on energy. Number third is blurred vision. High blood sugar levels can cause fluid shifts in your body, including in your eyes. This can lead to temporary blurred vision, which can be a sign that your blood sugar levels are not where they should be. Number fourth is recurrent infections. Elevated blood sugar can impair your immune system, making it easier for infections to develop. You might notice some frequent urinary tract infections or the yeast infections. If you are experiencing any of these symptoms, or if you are not, it is vital to get screened for gestational diabetes between 24 and 28 weeks of pregnancy. Your doctor will perform a glucose tolerance test where you will consume a sugary drink and your blood sugar will be measured to see how your body is processing the sugar. Now you might be wondering, how does gestational diabetes differ from type 1 and type 2 diabetes? While all three involve issues with the insulin and blood sugar control, the root causes and the characteristics are different. Number one, we will discuss the gestational diabetes. Gestational diabetes is unique because it is directly linked to pregnancy. It develops due to the hormonal changes that occur as the body supports the baby's growth. While it usually resolves after delivery, it does increase the risk of type 2 diabetes later in life for both mother and child. When it comes to type 1 diabetes, it is an autoimmune condition. In type 1, the body's immune system attacks and destroys the insulin-producing cells in the pancreas, leaving the body with little or no insulin. It usually develops in childhood or young adulthood and requires lifelong insulin therapy. But in type 2 diabetes, it is the most common form of diabetes and is closely related to insulin resistance, much like gestational diabetes. With type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to it. While gestational diabetes have some similarities with type 2 diabetes, it is a condition that is specific to pregnancy. However, it serves as a warning sign. Those who develop gestational diabetes are at a much higher risk of developing type 2 diabetes later in life. Now let us talk about managing gestational diabetes. A diagnosis of gestational diabetes doesn't have to be overwhelming. Here is how you can manage it effectively. Number one is diet and nutrition. Your diet will play a crucial role in controlling gestational diabetes. Focus on eating a well-balanced diet rich in non-starchy vegetables, lean proteins, whole grains, and healthy fats. It is important to limit sugary foods and refined carbs like white bread and pastries that can cause blood sugar spikes. Small frequent meals can help keep your blood sugar stable throughout the day. Carbohydrate counting and choosing low glycemic index foods can also be useful in managing your diet. Number second is regular exercise. Staying active is another great way to manage gestational diabetes. Activities like walking, swimming, and prenatal yoga are all safe and effective ways to improve your insulin sensitivity and control your blood sugar. Always consult your healthcare provider before starting any new exercise routine during pregnancy. Number third is blood sugar monitoring. Your doctor will likely recommend monitoring your blood sugar levels at home. Regularly checking your blood sugar helps ensure that your diet and activity levels are keeping your glucose in the target range. Number fourth is medication or the insulin. In some cases, diet and exercise may not be enough to control gestational diabetes. If that is the case, your doctor may recommend medication or the insulin therapy. Insulin is safe to use during pregnancy and can help keep your blood sugar levels in check. Alright, so now it is a time for a quick interactive quiz to test your knowledge on gestational diabetes basics. I will ask a few questions and you can leave your answers in the comments below. Question 1 is, what is the main cause of gestational diabetes? A. Lack of insulin production. B. Hormonal changes during pregnancy. C. Consuming too much sugar. Or D. Genetic predisposition. Question number 2 is, when are pregnant women typically screened for gestational diabetes? A. 12 to 14 weeks. B. 24 to 28 weeks. C. 32 to 36 weeks. D. After delivery. Question third is, which of the following is not a common symptoms of gestational diabetes? A. Increased thirst. B. Weight gain. C. Frequent urination. D. Blurred vision. Question 4. Can gestational diabetes increase the risk of developing type 2 diabetes later in life? Your option is A. Yes and B. No. Great job. Let me know how many you got right in the comments below. And don't worry if you missed a few. Managing gestational diabetes is a learning process and I'm here to help. And there you have it, everything you need to know about gestational diabetes. From understanding the causes, identifying symptoms, and managing the condition, you now have the knowledge to take control of your pregnancy health. Just remember, while gestational diabetes can seem daunting, with the right management, you can have a healthy pregnancy and give your baby the best start possible. Thanks for tuning in today. If you found this video helpful, please don't forget to like the video and subscribe to the Medifit Mosaic. And hit the bell icon so you never miss out on future content. Be sure to share this video with any expecting mothers you know who could benefit from learning about gestational diabetes. I will see you in the next video. Until then, take care.